morning everyone. This is Dr. Nitin Sethi. I'm a neurologist and today we're going to discuss headaches. Headaches are a common neurological disorder. In fact, one of the most common neurological disorders is headache. They occur around the world, occur in young people, older people, men and women. And broadly speaking, when we talk about headaches, we can divide headaches into what is called secondary headaches and what are called primary headaches. Secondary headaches, as the name suggests, are secondary to something. Like for example, somebody has headache and you do an MRI of the brain, heavens forbid they have a brain tumor. On the other hand, far more common than secondary causes of headaches are what are called primary headaches. And there are 2 or 3 main primary headaches. For example, one is migraine. You must have all heard about migraines. The second is what is called tension type headache. And the third is what is called cluster headache. Migraine, which is probably the most common primary headache, more common in women than men. I get migraines. Typically the patient is fine and the migraine attack comes on. Usually it's a one-sided headache, sometimes on the right side, sometimes on the left side. The patient will describe it as a throbbing, pulsatile headache. Somebody's like hitting, pounding on your head. At that time, people are light sensitive. Bright lights bother them, sounds bother them. They prefer to lie in a quite dark room. At times they are nauseated. Some of them will throw up during the migraine attacks. And it's important to try to identify your triggers for migraine. Migraine has triggers. The most common trigger for migraine is stress. You're more likely to have migraine if you're under stress. You're more likely to have a migraine if you're dehydrated, if you miss a meal. Like I told you, I get migraines. I cannot tolerate red wine. If I take red wine is rich in sulfites. The next day I have a throbbing headache. So certain beverages, alcoholic beverages, cheese, chocolates can trigger on migraine attacks. So if you get migraines, go do and consult your neurologist. Usually the neurologist, by taking a good headache history, is able to identify what kind of headache do you have. Is it a primary headache? Is it a secondary headache? If it's a primary headache, what kind of primary headache is it? Are we dealing with migraine? And then the good thing is there are really, really good drugs nowadays to treat migraines. I hope that helps you and take good care. Bye-bye.